The use of light sources such as lasers or intense pulsed light (IPL) systems requires a deep understanding of their risks and safety conditions. These devices are classified into different classes based on their hazard potential, with classes 3B and 4 posing the highest risk of thermal damage or eye injuries if not handled properly. Their use is indicated in treatments such as hair removal, pigmented lesions, rejuvenation, and telangiectasias. Safety begins with proper equipment selection, calibration, and adequate protection of the clinical environment and the patient. The retina is especially vulnerable to laser damage, as it focuses the energy directly on its surface. Therefore, the use of protective goggles specific to each wavelength is mandatory for both the professional and the patient. The nominal ocular hazard distance, NOHD, and the maximum permissible exposure, MPE, must be identified, with physical barriers or clear signage established in the work area. Reflective surfaces that could disperse the laser beam should also be avoided. The laser must remain in standby mode when not in use, and smoke evacuators should be employed in ablative procedures. These devices are indicated to treat spots, vascular lesions, active acne, among others. However, their use carries additional risks: exposure to biological contaminants in the form of aerosols, thermal burns, eye injuries, or electrical accidents. Prior evaluation of the skin, phototype, and possible contraindications, such as pregnancy, photosensitivity, or a history of abnormal scarring, is essential to prevent complications. It is also recommended to have standardized work protocols, follow-up sheets, and documented preventive maintenance of the equipment. The work environment must be controlled, with opaque walls, visible laser signage, and no open access during the procedure. Training of both technical and clinical staff in the safe use of lasers is essential, as is compliance with current regulations. The combination of correct technique, certified equipment, and protective barriers ensures that light-based treatments are performed effectively and without risk to either the patient or the professional.